you for the opportunity to be on the panel and to describe how a set of learning objectives for resident global health education were developed and are being implemented. And I'd just like to acknowledge that our lead organizer of this presentation is actually Melanie Ansbacher, who unfortunately couldn't be here today. And I'd also like to acknowledge the contributions of Nicole St. Clair. Okay, so why should we even be worried about or concerned about establishing standardized curriculum or learning objectives? Why bother? Well, first of all, there's the demand that's being generated by the trainees themselves, as was so well articulated by Richard Dunning. The demand crosses disciplines, it crosses specialties, and it actually impacts applicant decisions when it comes to ranking residency programs. And more graduates are interested in careers in global health. They're interested in volunteering overseas. And even among those who have no interest in working overseas, there's increasing interest in learning the fundamentals of global health, because the greatest burden of disease is obviously in developing countries. Furthermore, with increasing travel and migration, more and more North American physicians are seeing increasing numbers of immigrant patients, doing travel medicine, and of course, combating diseases that don't respect boundaries. And the determinants of poor health, things like poverty, inequity, lack of access to health care, these are things that impact health both in developing countries as well as within our own borders, and are important to understand if we're trying to impact health in those places. So there's the interest among the residents, and there are educational reasons to implement global health curriculum into residency programs. But there are barriers, there are difficulties, including a lack of curriculum and guidelines, particularly at the postgraduate level. And this was identified as a major barrier by an American Academy of Pediatrics working group on resident global health education. This working group was established about 4 years ago to address barriers in resident global health education, including the lack of global health guidelines and curricula. And we did this by developing a comprehensive set of learning objectives, which I will describe in further slides. But these were published by the Global Health Education Consortium a couple of years ago in the CUGH guidebook, in a chapter in the CUGH guidebook on residency training. And more recently, a collaborative group within CUGH has worked on expanding these objectives to the disciplines of obstetrics and gynecology and internal medicine. And these will be published in the next edition of the CUGH guidebook. Now, we acknowledge that these are certainly not the only learning objectives in global health that have been developed, but to our knowledge, this is the first set of comprehensive global health guidelines that have been, global health learning objectives that have been developed for residency programs, and they've been used by at least some pediatric residency programs to date. These are not intended as prescriptive requirements by any means. They're actually intended as a flexible tool, as a guideline that can be adapted by individual residency programs who wish to develop or implement their own global health curricula. And that is also the intention of the multidisciplinary guidelines as well. An important feature of these guidelines is that they were developed to fit within the framework of the ACGME competency-based framework, which was introduced more than a decade ago as a framework for residency education and evaluation. There are 6 competency domains, and each individual specialty or discipline develops specific goals within each of the 6 competency domains. So it made sense to use this familiar paradigm when developing the global health learning objectives as well. Now this is just a snapshot of the first page of the pediatric global health learning objectives, and as you can see, it does fall within the ACGME framework, starting here with competency number 1, patient care. And the next couple of slides just show examples of the objectives under each competency. You know, of note, the ACGME framework was developed really for use in a clinical setting, for clinical education. But we were able to to include important public health, health policy, and ethical issues that are important to understanding global health within this framework. So for example, under the second competency, medical knowledge, the first two objectives that are listed actually deal with epidemiology and determinants of health, and these are listed above clinical objectives that deal with specific diseases. These are just examples of objectives that are listed under the competencies 4 through 6, including, for example, an objective that deals with the health workforce crisis in resource-limited settings. Now, for the multidisciplinary objectives, some of the objectives really require delineation by specialty. So, for example, the epidemiology of mortality, which was divided by specialty, while others lent themselves more easily to globally across the disciplines. For example, determinants of health and the human resource crisis in developing countries.
We decided to share this presentation. I'm Suzinne. So after that, the question is, how do we apply these learning objectives? The most straightforward and common application has been to develop curricula in global health for residents. A number of programs have actually been able to use these guidelines as a template to design their own curricula, including the pediatric departments in the universities of Wisconsin, Minnesota, the Children's National Medical Center in DC, and certainly here at the University of Washington. They've also been used to develop individualized learning plans, as well as to plan goals and expectations for resident experiences overseas. And they've also been used to facilitate development of self-assessment tools for residents and program evaluation to monitor the progress made with these individualized goals, and also to help identify gaps in the resident training. So with respect to curriculum design, these learning objectives have been a useful format for programs to think through what the teaching venues are with a busy resident schedule. For example, many of the competencies related to medical knowledge and system-based practice may be best met through the venue of noon conferences, evening seminars, even visits to local global health organizations to facilitate getting to know how those groups work and what they do. Learning objectives in patient care may be best met through case-based learning approaches, direct clinical experience, and maybe specific local clinical experiences. And then also the practice-based learning and self-improvement type of learning objectives may be best met through journal clubs looking at the best evidence for healthcare management or critically reviewing WHO guidelines for disease management. And for professionalism and communication, for example, certainly mentoring and role-playing, as well as case-based teaching are useful venues. So here's one example of how these learning objectives were initially applied to the curriculum at our own University of Washington pediatric program. This is a 3-day snapshot of this month-long intensive curriculum. And here, learning objectives related to recognizing socioeconomic determinants of health, understanding global health organizations, and ethics of global health, for example, were carried out through presentations and discussions with speakers. We also had problem-based learning exercises, meetings with mentors, and then site visits at some of our local global health organizations. The application of global health competencies to international electives also helps to more appropriately prepare residents for these experiences. And here are some examples. For patient care and practice-based learning competencies, they may be met by supporting residents to recognize WHO guidelines for managing specific conditions, for example. System-based learning objectives of understanding the factors that contribute to healthcare workforce crisis in developing world may be met as residents engage with health professionals at these international sites and observe firsthand the challenges that they face in serving vulnerable populations there. In terms of medical knowledge-based learning objectives, understanding the socioeconomic determinants of health, for example, may be best met by meaningful visits to communities. And communication-based learning objectives may be best met, for example, training community health workers. And then finally, the very act of planning and thinking through a responsible and ethically guided international experience supports competencies and professionalism. And so the application of these learning objectives to resident self-assessment has actually been carried out by the National Children's Pediatric Program that generated this 5-point validated scale for measuring what they were calling level of mastery for residents to quantify their change in confidence level both before and after international rotation. Program evaluation tools that also follow these global health learning objectives have been developed, and use of such evaluation tools by faculty as well as by international site supervisors ensures useful feedback both to the residents, the program, as well as to the international partners. And certainly this is an area that should be a priority, I think, for programs developing global health curriculum. Much more needs to be done in the area of evaluating outcomes for resident education and global health on careers as well as on healthcare and capacity at these international sites. So in terms of future plans for this working group that developed these guidelines, one, as Donna mentioned, is to disseminate these learning objectives across multiple disciplines. It's also hoped that by highlighting the many common global health learning objectives across the programs, that there can be some opportunities for shared learning. Also, this group is working to advocate to strengthen collaboration between residency programs. And for example, Melanie Asbacher couldn't be here because she's actually talking to the American Pediatric Directors Program to advocate for global health support. And then this core group of learning objectives are also being applied to the development of a series of electronic pediatric teaching modules for residents. These modules will assist in smaller programs to meet global health learning objectives that otherwise may be difficult to attain due to a scarcity of faculty in global or public health at those sites. And then finally, we're working to develop a consensus on developing a core set of the global health competencies that all U.S. residents, regardless of their career interested in global health, should be expected to meet and might even see on the board exams. Ensuring that all U.S. physicians possess an understanding of the basics in global health is really, we felt, an important step towards ensuring global health citizenship. Thank you.